Hello, my name is Danny Masters and I am a physical therapist at Core Therapy and Pilates. And today I'm going to be discussing the article put out by the Harvard Medical School and Harvard Health Publishing about home remedies for low back pain. Now, I'm going to be discussing and reviewing the findings in the article and discussing the content, but this in no way is a prescription or is a substitute for professional medical advice or diagnoses for low back pain. As mentioned in the article, 80% or 4 out of 5 Americans will experience low back pain at some point in their life. Now, this predominantly can happen as we start to age. Now, this can happen due to changes in our actual structure of our bones and joints. Now, this can include changes and degeneration of your discs, which are the structures in between your vertebrae that help kind of cushion and support your back. And then this can also lead to, now this is less frequent, it can lead to what's called a disc herniation, which is where part of the disc actually protrudes out and compresses on the nerves. Now, when it compresses on the nerves, this can affect pain in your leg, and then when it actually hits the sciatic nerve, which runs down the back of your leg, it can affect your buttocks and the back of your leg, and this is what we call sciatica. Now, also discussed in the article, the much more common injuries to your back can occur from sprain, which is when your joints are injured, or from a strain, which is when your muscles are injured. Now, there's a couple common ways that this can happen. So it can be from overuse, so you're just like bending down, picking things up, kind of repetitive motions. It can be from a change in activity, so if you go from not really exercising or not really doing a whole lot and then you try to do too much, you can cause low back pain. It can also happen from lifting, excessive lifting, so especially if you're not using the right form, or it could be from just an accident, so like you went and you picked up something funny or something like that. Now, as talked about in the article as well, normally the best thing to do is just kind of wait and see. So sometimes a lot of the time back pain will kind of subside on its own. Now, if you've been waiting 3 or 4 days and you've tried some of these home remedies that I'm going to discuss and discussed in the article and the pain still persists, then it's time to go seek a health professional such as a doctor or a physical therapist. Now I'm going to discuss some of the remedies that were talked about in the article, and once again, if this lasts for 3 to 4 days, it's much better to get the advice of a health professional, and this is in no way prescribing or is a substitute for professional medical advice. So the first option talked about is one that most everybody is kind of familiar with, is ice and heat. Now, ice can be really effective when you first start feeling the pain or you first have the injury. One, because the ice will help numb the pain, so it won't be as painful. But two, usually after an injury, you have inflammation, so like the redness, swelling, heat coming off of it, and that can be effective in reducing that inflammation. Now, after the first 48 hours or 2 or 3 days, then heat can be applied. Now, heat will help activate your blood vessels and will help bring blood to the area. So that can help with kind of bringing oxygen, bringing blood, bringing nutrients to the area. And it can also help relax and soothe the aching muscles, especially after the injury, they start becoming stiff to help protect the area. Now, after about a week, especially heat is no longer effective. So if your pain is persisting and you've tried this and it's lasting over a week, once again, it's kind of time to start seeking some professional help. The next section I'm going to talk about is limiting bed rest. Now, bed rest has been a traditional treatment for a long time, but in recent years, doctors and research and physical therapists has shown that excessive bed rest can actually hinder the healing process, and it actually can take longer because your back really needs the support of its muscles. And if you're in bed for too long, your muscles can get stiff, and then you can also start losing strength, which you're going to need to help support your back. Now, with certain injuries, especially if the pain is really, really severe, you can, especially severe with sitting or standing, you can lay in bed but limit it to a few hours a day. The other recommendation is to really stay active. So, find things that you can do that are pain-free and continue to move, because like I said, if you're laying in bed, the muscles tend, and you're not moving, they tend to get really stiff, and then they also start to lose strength. So remaining active, as long as it's pain-free, is a very good way to go. The next section is about physical activity, which is one of my favorite, as being a PT. That's pretty much what we do. So exercise is one of the best treatments for low back pain. So as I was talking about, a lot of low back pain can be stemmed from, lack of core strength and all of that kind of thing. So developing a physical activity routine is key for, one, not only treating the injury, but two, also helping prevent it. So this can be done with an expert coming up with a treatment protocol and treatment plan, such as a physical therapist or a doctor, and they can prescribe you specific exercises that you need for your specific issues. So in general, this can include improving your aerobic capacity, so your ability to run, walking. It can increase your strength and endurance for your muscles and improve your flexibility. And lastly, the article discussed some other complementary therapies or treatment modalities that you can use to help relieve your back pain. Now, the first one is acupuncture, which uses a thin needle to help improve the energy flow in your body by putting them in specific locations. And another technique is called dry needling, which can be done by a physical therapist, which uses the same kind of needle, but it places it in precise locations in your muscles to help relax those muscles and make chemical changes. Next, the author talked about spinal manipulations, which is a technique used by PTs or chiropractors, which can assist in improving the spinal alignment. And along with that, PTs can also do what are called mobilizations, which can help improve the mobility and stiffness of your joints. Therapeutic massage is also another technique that can be used by a PT or a massage therapist, which can help relieve your aching muscles, along with movement therapy such as yoga, tai chi, and what we perform here at Core Therapy and Pilates is Pilates, which will help improve, stretch, and strengthen the muscles in your back and your core. Now, per the article, it mentions that the research on these modalities and treatments is kind of mixed, but with best results have been shown to use kind of a mix of these different treatments. And as we talked about before, if you tried these and your pain either doesn't reduce or continues to persist, it is recommended to go seek professional help from a physical therapist or a doctor or other healthcare provider.